there's some evidence that in the book it's cited that medical error is 14th on the list of reasons for global disability and it's in terms of error, it's third leading cause of death. Is this a larger problem than perhaps the general public appreciates, maybe, or even the medical community?
Yeah, it's a huge problem. The Institute of Medicine reckon that about a third of all the healthcare that we provide is unnecessary or low value, and another 10% on top of that third is actually harmful. So if you look at all the healthcare that's being provided around the world, and if you think 10% of that is harmful, that's a hell of a lot. It's difficult to get the extent because people don't put medical care on the death certificate. It's not listed as a cause of death. So it's difficult to quantify. There was a paper written saying that it was the third leading cause of death, but it's very difficult to quantify these things. And it's how many 100,000 deaths a year in the US are caused by medicine. A lot of these studies are a bit dated now, but what is consistent is this sort of 10% rule. And it's been done in not just sort of developed countries, but in developing countries even. And so around the world, whenever this has been looked at, it's come out at 12%, 9%, 10% harm rate. And so it's a fairly consistent finding. And to add to what I said before, it's not the price we pay. These are harms that are unnecessary and avoidable. A lot of the research also is focused on hospital care, in reviewing hospital records and things like that. And it really doesn't measure what happens in the community. And I think that there's a lot more unnecessary care in the community and arguably a fair bit of harm in private practice, consulting practice, prescription writing, that kind of thing, things that happen outside the hospital. They're often not figured in those data.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.